Welcome to the session on breast cancer promotion and prevention. My name is Melba DSousa and I'm a registered nurse and a certified medical surgical nurse. I have worked with patients who have had cancer and related care for cancer. I worked with patients who have had breast cancer too. Currently, I'm doing a research on breast cancer, exploring the knowledge, experiences of people with breast cancer and to look at long-term plans for patients' voice and perspectives to create a patient engagement model. My interest in breast cancer had been for some time, and I've worked with people in prevention of breast cancer in the Middle East and in India, where my background origin was. And I have come across people when they have clinical experiences, have been in the clinical, where sometimes the people who have had a cancer would usually think or blame themselves that this is what cancer happened to me. Maybe there's something that wrong I did with myself, something wrong I have followed, my diet or exercise. So people tend to blame themselves. But when you look at cancer over the wide variations across the spectrum from different countries, people from different origins, from different spaces, you will look at and see 2/3 of the variation in cancer is due to unknown reasons, that there is no reason why this happens. It's beyond our control of every person. There are things that we can do to prevent and promote our health, but other ways, certain cells, how they react to certain agents in the environment, and which is very different for one person to another person. And that's why it's difficult sometimes to explain how our tissues behave in this environment. And at the time when maybe it is recognized or it is required for treatment, it may look different than how it was originally. So our main attempt for this presentation here is to look at just an idea what is breast cancer, how to be aware of breast cancer for ourselves or someone we know, what is just general idea of statistics, how do we know what risk factors and what does it mean for myself, what is the meaning of risk factor and how do I reduce that risk factor for myself, and what are support services available and resources in Kamloops or with the healthcare system we have in BC or in Canada. So that is the main thing. And my interest is also to know from you what has been your experience, not with yourself or maybe with anyone, has your reason that you are being here participating. Would anyone like to share like why you have come to the session, for any experiences? Yes?
When my grandma was 97, they actually found a breast lump. Yes. And they, believe it or not, operated on it. And I was curious to know, from anything I've read, at that stage of her life, her cells would have been moving so slowly that I wanted to know if they thought there could have been progression, because going under the anesthetic actually caused her heart condition that she didn't have before that. So I was curious knowing why a doctor would feel the need to operate at 97, because everything I read said that as we grow our cells slow down. I just want to better understand how that.
Yeah, that's a good question. There are people who say that because after 70 years, like you said, the same thing applies, and that's why RBC or Canada guidelines for cancer or even breast cancer detection is based on that, what they have, the benefits of risk and the benefits of the advantage to the person for improving their quality of life. So if there's anything that you like to add to this, we can add it now if you want to talk about it. And we will begin the session. There's a small booklet that I've given you that has first a pre-test. It is just for yourself. I will not be taking any answers from that, but just for you to know. You can glance at it and see what are the questions and how you would have answered it for breast cancer if you just turn to the first page, you'll have that. You can read the question and take a time what you would answer. So the answers to that is given in the following pages. And at the end of the session, when we complete the session, you can take again the same test and see what is it that makes you to understand an awareness about breast cancer and how it can be applicable to you as a commitment to change or to people who you know to understand breast cancer more. So when you hear the term breast cancer, what does it mean to you? You know, people have experiences with breast cancer, and you had said about it just now. But when you just hear the word breast cancer, what does it mean?
Fear.
Yes. A fear.
That's what it means.
Yes.
I'd say associated primarily with only females.
Yes. Yes. To a large extent, yes, 1 in 8 women in Canada, there's a risk to get a breast cancer. And every 19 seconds, there's one woman who's diagnosed with breast cancer in Canada. And every minute, there's one woman who dies of breast cancer in Canada. Not to say it's not there for the men, but it's to a lesser extent. So women, 1 in 25, almost 25% of them is diagnosed with breast cancer in Canada. And then they have the other cancers like the colorectal cancer, thyroid cancer, and melanoma, the skin cancers, which are common among women. So primarily cancer, breast cancer means for both men and women, for any kinds of populations. It is the changes in the cells that takes place, and because it is mostly, like we say about women, we talk about femininity, their role in the family, their role in society, and that's why it's become a very, it's been promoted in mass media along many years of people doing different things to prevent breast cancer. So cancer as such is, like you said, a fear that people have because it's not within our control. It's not something we manage. We hear the words like people talk about cancer survivor or a person who is thriving in cancer, which are very different. But it's very hard when we look at our patients who we care for because, like I said on the first time, it is beyond our control. Even if you have a treatment option, there's a treatment that can be done for breast cancer. But how the person reacts to the chemotherapy, the radiation, the surgery, or hormone therapy, or the immune therapy, or the HER receptors is very different from one to another. So it's not actually the person that is, whether he takes an initiative or not. It's more of just developing a positiveness and confidence. And that's why breast cancer means a lot to us because it's the image, it's that what we portray ourselves when we are in a public place. And so it means so much. And mass media has taken a lot of interest in the breast cancer because of this. This statistics is just to give you an idea. It's not a comparison between Canada or USA. It's all over the globe. Like I mentioned, 2/3 of our population is having the cancer, and I said about the statistics that is applicable all over. USA is a much bigger population, so the recent statistics of USA is different from Canada. It just shows the kind, if you look at the implications on economic life, lifestyle preferences, and that makes a difference to people. If you see in Canada, the mean age by when a person may be diagnosed with a breast cancer here because of the screening procedures and mammography is around 40.5 years. But in USA, it's different. They take it by median, so it's around 60 years they are diagnosed with breast cancer. There's always new cancers being diagnosed with breast cancer. So 1 in 4 is always diagnosed with a breast cancer, and the numbers increase. But since the late 1980s, there's a lot of research, a lot of monies have gone from federal, from the provincial, from people, from the community to help to support breast cancer. They have found a lot of kind of treatments helping to find out how can we curb it or help to control or someone to live with the cancer as much as he can for a good quality of life. And that's what's important here in breast cancer, is promoting breast cancer as how do we prevent it, and person who has it, how do we promote their health when they have it. So like you mentioned, the cell, the cancer is the cell. It's something that grows rapidly in each one of us. We all have tissues, and that's basically what is breast. It is a tissue, it's a stroma. So that tissue starts at some time because of some agent that is there within the person, exogenous or endogenous. It takes a turn, it changes. And it changes in such a way that it can be in a very structured way. So it can be a benign, or it can be in a very unstructured way, very undifferentiated way. There is no way how it's going. So it can be random, then it will be a malignant cancer. So and that's why we are concerning to how we can limit the cancer, how we can remove out the cancer and help to preserve that tissue that is there and help that tissue to grow and develop in the environment that it is developing. And cancer makes such a meaning for us today because we're still not able to understand, like I said, why do these cells rapidly grow, proliferate, they increase, they go out of shape, and they do not follow the laws of cell. We all have cells, we all learn cells when we are small. Every cell goes by a certain law, the epithelial cells or basement membrane, and that is the important thing in breast cancer. It has its own cells, it has its own basement membrane, own epithelium. And that's when hormone changes take place and starts to break this cell, and cells just start to grow rapidly and no one has control over these cells. We all know a little bit about our breast. I'm just putting out a picture. I took a very basic picture. There are a lot of beautiful pictures on anatomy and physiology, but that's not my intention for today. But just to know what is the breast, why is it so important? The breast has just two tissues actually, primarily. It's just the fat and it's just the breast tissue. There are two. They're called glandular and stromal in medical terms. So it's a very complex system where it looks very pictureful and colorful to you, just to show the importance of how the tissues are complex network of lobes and lobules That's the glandular part, the ducts. And all these, the primary function of the breast is for mainly, I said, femininity, as sexual, as reproductive, as when they have babies. So the end product is all these lobes, and you can look like grapes. They look like bunches and clusters of grapes, and that's how the cancer cells can spread very easily once it's there within. So if it contains itself in one cell, it's benign. It just remains within its law and doesn't go too much. It's like I can say, like a good cancer, it behaves itself. Okay. The rest of it is like the bad, the ugly. It doesn't behave itself, and it causes different changes to the body and to the person who has it. So a person may not die directly out of breast cancer until, of course, they are in very late stage, 4 or 5, when it has gone into the system and it's metastasized into the bones or into other, and that's when the prognosis changes for a person. So when looking at the breast, we mainly have the pectoral walls, the tissue walls that we have on, which connect it and hold the breast, and then you have the breast tissues. So what is important, the part is to looking at it is why it's like this structure. When we do breast examination, you'll understand of why it's so important, why it's holding these structures, because that's when the importance of examining ourselves or knowing when a change takes place is just knowing why we are examining in that way. So the important part are the lymph glands, that is the axillary, and just above our cervical and just below our clavicle. So these are the important parts. Usually women sometimes tend to develop cancers which start usually in the axillary, because that's where the main lymph nodes are, and then it goes to other parts. The rest of it, there are 2 types, the benign and the cancer. So the nipple is very important in this part to remember, because that causes also a change where one needs to notice a change in the nipple, or discharges from nipple are very abnormal, and it has to be immediately. It's like I told, it's contained. You can never say it's small. It's inside, benign. Sometimes they're not even being able to feel with our hands or seen by observing it. But the nipple is something one can observe very much if it just changes from what it was before. And that means it's not a good sign. It's like Page's cancer. So what causes breast cancer in your view? What you would think? In community, we hear sometimes people who had a breast cancer, they'll say, the doctor said something to me about breast cancer. In your view, what you would think is breast cancer? Hormone changes, as we go along. Develop stress, and hormones change, estrogen, progesterone. The HER2. There are a lot of receptors. These are the 3 main things that keep changing in a woman during her life cycle itself. So we can't stop it. Someone said being a female, our age, these 2 things we cannot stop in our life. They go on.
Diet.
Yes, diet changes that we take.
Physical literacy.
Yes.
Yes. Yeah.
Literacy.
Yes.
Exposure to radiation.
Exposure to very, very high radiations. The smaller amounts that you take from chest X-ray or mammography or ultrasound, they're very, very tiny to accumulate. But if somebody had lymphoma, had major cancers in their life, had to take a radiation for the benefit, then those high radiations are living in different areas of the world where radiation was exposed, in Hiroshima, Nagasaki, in different parts where radiation would be. People have been exposed, they have developed cancer over that, because that has changed completely the structure of the cancer cells. Okay? There's not much study done with microwaves and lasers and all, but they say they tend to accumulate in the air when all these are exposure to radiation. Genetics, yes. So you have 2 things in genetics. One is heredity, which is a 5 to 10% alone, which tells you about cancer so much, breast cancer. 5 to 10% alone only is heredity, but the rest is from a different lifestyle. And from that 5 to 10, there's very few, what she said is genetics is different. Genetics is that your cells mutate by itself from a certain ancestry, like the Jewish ancestry, Ashkenazite, or someone from a different race. The way how their cells have been developed is different. So there are some ideas that we have something which we can change, like we said, we can modify, and there's something that we cannot, and that causes we cannot prevent. So all we can do is to be aware of ourselves how it is. Like she mentioned, genetic mutations, and they can be by themselves, so we cannot stop them. And they can be inherited too, like 5 to 10% can be inherited from them. When we always talk of someone in the family, when you give your history to your GP, it's always important to tell about your heredity. When you talk to your family members, to your parents or side or maternal side or paternal, it's always important to ask them in the family about what cancers were there, because that makes you alert when you talk to your GP, gives you an awareness what you are risk for. So when you look at breast cancer, when you say this to the doctor, they will immediately put you on the high risk profile, like heredity. You go through a heredity screening, which is so different. So they're able to screen you out earlier, and they keep tabs on you. So BRCA1, the breast cancer 1, and BRCA2. So BRCA1 is around 80% of the people, if they have had it. 80% of people who are, most of the populations, if it is heredity, between 5 to 10%, and 80% of that population is having BRCA1. There are higher chances for them to get breast cancer along the way, anytime along their way. And BRCA2, if somebody is having it, has almost 70% chances for them in that hereditary population to develop a cancer at any time in their life. So it can be breast cancer or the ovarian cancer, they are two together. And that's how we know that sometime years back, Angelina Jolie, she had done the test and she found out she was at risk, but she did not have cancer. So she took the completely risk reduction method of prophylactic mastectomy for both the sides, left and right. Okay? So there are some people who do that. So that is one risk reduction method they have, but it's not there for everyone. Okay? They have different other methods like genetic counseling, which is different from genetic screening. Genetic counseling where they taught you everything about the genetics and how it behaves. So, like I said, heredity has two parts. It is heredity. It may or may not come. The myth is that it develops in everybody, but no. Heredity people, even if 10% was there in your family, you may or may not develop the breast cancer because the way your cells react to what happens. So, looking at, remembering the picture of the breast cancer the breast that I showed some time back, important to realize that not all things that we find abnormal when we assess our breast is in fact a malignant or a cause for cancer or anxiety, because that stops women not to examine their breast or to know or feel how their breasts are. So there are some conditions which are just by themselves, and some people live with them throughout their life. They're small cysts. They just contain small liquids in between fluid. If they grow and they develop, then it may need time for them to be removed or excised. They can be fibroadenomas, they can be small hyperplasia cells, small calcifications. What is important is the calcifications is what we try to screen, try to look every 6 months or every year, depending on what's your doctor's screening for you. Just to know if that calcification is calcified. Because all of us take calcium, and it's not because of that calcium, though the name shows calcification. It's just like there's something different. But it has to be observed and looked for whether this prognosis gets into a cancer form. But the others are very small changes that takes place. Okay? Sometimes some people have mastitis or inflammation during the time they're expecting or after that when they're breastfeeding or anything. So not always a mastitis person will develop a cancer, but there are certain inflammatory conditions which develops into the breast cancer that will develop into a cancerous lesion. So what the meaning to tell you is breast cancer is a family. It's a family with itself. It has different changes that takes place in the tissue, and not all of them are malignant or very dangerous for us, and they don't develop into breast cancer. They just have a lump, like you said the word lump, or it's hard, or there's a cyst that needs to be examined, so it's something different. So the messages that we are having today based on this small discussion about breast cancer is just knowing our risk. Am I at risk for breast cancer? Looking at the things, what is risk factor for breast cancer? Because there's no exact cause effect to tell what was the cause and effect. There's only statistics which show this much percentage. What is normal for you? For your breast may be different from another person. So what's normal for my breast? There could be a change, there can be something I feel abnormal, but has that changed over time? Get screened. So get ourselves screened when we have the time to screen. If we found there was a change, or by the protocol from PC, the breast cancer, that at age of 40 years, that's when the screening mammography starts. And lifestyle choices. What do we make is up to us, lifestyle choices. There are choices to be made, and what is the preference and choice we like to make out of it. Okay? So just knowing our risk, what do you think when we say knowing my risk? What is my risk? Today every disease, everything has a risk factor. So just knowing what is risk for me is simply, like I said, talking to our family members. In some cultures it's hard because the way the families are structured, especially Southeast Asian in some cultures, but today people talk and voice about it. Just knowing, was there a cancer anywhere in the family? Ovarian cancer, uterine cancer, any cancers, like I said. Is there a breast cancer in the family? So just knowing that from both maternal and paternal, when you know that, just talking to your doctor about it. This is there. So that's there.
So that's any type,
radar.
any type of cancer.
Any type of cancers, and then about breast cancer. Was it a breast cancer?
Mm-hmm.
Because the BRCA1 and 2 is also linked to the ovarian cancer, cancer. So just to know, isn't there? There are many risks. There are many types of genes. There are more than 16, 20 genes which are linked to the breast cancer. The two very common is the BRCA1A and 2. And they do a lot of genetic screening on this based on what is the person risk for to find out. So not everyone will be going through a genetic testing. So just knowing about this, because in first degree relatives, it puts us at a disadvantage as 2 times the average risk than a normal person. I have a family, my aunt has breast cancer, I am more at risk, okay, to get a breast cancer. My sisters are more at risk to get a breast cancer. My sister's children and my children are more at risk to get a breast cancer. The same goes for the male, so there is no difference between the male and female. If there was breast cancer for the male person, it goes down the family. Okay. So in the community, have you heard of what increases the risk of breast cancer? From people, they think, what they talk about, increasing my risk of breast cancer.
I hear family more than anything. People will say, oh, if it's in your family, that's I don't think that's really.
Yeah, there's a thing that people are not very clear because we don't have it out in cancer, what is actually the cause and effect. But there is an inclination like, okay, maybe someone's taking too much alcohol, that changes the estrogen level. Someone's been on a long-term estrogen hormone replacement for some reason. But some people may just take it because maybe it adds some rigor to their life or their health. And that's when they say like to reduce it. Reduce those kinds. In the past, previously, the oral contraceptives, they used to put some amount of estrogen, progesterone, it's not good. And they have stopped that now because they cause some changes to the body. Now we have got new products in oral contraceptives which are much better and which are much, do not cause or make someone at high risk for cardiovascular or for cancer. So the diet, like you said, consumption, the person, stress lives that they have, it does changes a lot of their hormones. Because if you remember the picture of the breast is situated in such a way that it's at the heart, it's at your heart, it's the center of your heart. So it has the lymph glands which will drain out all. It has hormones that change. It has its immune system, WBC, which comes to attack. So if you have any infection in your body, it may not be related to your breast, but it's your WBC that comes to attack it. So then if it's clogged or blocked in your breast cells where the tissues or the blood vessels go out, then there's a chance that something's going to deposit in those cells there. So coming on from different things. So like you said, there are different factors, but to understand what does it mean to me, how do I reduce risk? Can't change the fact that we are women or we are with age. And there are different screening modalities for people from different ages in Canada. So screening is allowed for different, after age of 30 or 40, you have screening techniques which are there, which are allowed for women up to 70 years. So like you said, family history. So if you are aware that there is a risk of a family, in the family somewhere there is a risk, getting to your GP and getting yourself genetic counseling. It's different from screening and testing. They're all parts of counseling, but counseling is very different. Counseling is they go through every single thing that you have. They go through all the risk factors that they have and they have a real discussion with you about getting all those. Those are just helping them. They are like parameters that help them to be able to understand and help you to counsel along the journey what are things that can be helpful and what cannot. There are some things that can be done. They're like I know patients who have had partial mastectomy or have had a radiation or had some other things where they felt that there was a risk. But it's not that everything is only just talk. There are certain ways of how they do the genetic counseling. So weight, which tends to happen, especially after a certain age when the estrogen progesterone changes. So fat tissues, they start to change and that develops. So lifestyle changes that we need to make, consuming alcohol. And then they say a woman, if they have had a child, breastfeeding is very good. And increased number of years of breastfeeding helps to keep those estrogens or those hormones in place. Okay, it doesn't increase them or aggravate them. So they say breastfeeding during the time as much as they can when they have had children is helpful and has shown studies. Around 42 to 54 studies were shown around the world that have helped to reduce their risk towards the breast cancer. The percentages of risk. Like I said, if it was 0.5% if they are less than 30 years, it goes up to 2.5% if they are like 40, 50, and then it increases 30 to 40% as you go above 50 years, and then go as you get older. Is getting older, you're not making change. Like she was bringing the point. So I want you to take a moment to just think about what we talked now and what was it that hit you. You can each one maybe talk to your right-hand person to see what was the important fact that you learned from this today, or what did the other person learn from this today. Then you can keep your questions if you want, and you can take them at the last. Any questions you have?
I'm actually interested in one of the statements here, just other risk factors, and you talked about age and breastfeeding a child, and one of them is having a first child after age 30.
Yes.
Why would that be a risk factor? Or how does that increase or chances of that of having breast cancer after 30, after having your first child at 30?
That's a very good question. So, if very early menopause or some early menarche or very late menopause, the change in the hormones, estrogen and progesterone.
Mm-hmm.
The same way goes with having a child very late. It causes some changes in the hormones, estrogen and progesterone.
Mm-hmm.
So that's called a triple negative cancer, where there's a change in the estrogen, progesterone and HER2 receptors.
Oh, okay.
So that's the human receptors, epithelial receptors. So that changes causes someone to be more at risk. It's not sure that they'll have, but it just makes them at
And
higher
then with
risk.
age, because you're getting
Yes.
older, that changes more.
Yes.
Yeah. Oh, okay.
This contributes to that risk.
Interesting. Because our population is, I think, having childbearing is getting a little older.
Yes.
So, yeah.
32 and 38.
Just interesting.
It just says that the risk is high. It doesn't say that they develop.
No, yes.
Yeah.
Yeah.
Higher
Your
risk
risk
because of
increases
that.
by X.
Yes.
Yep.
Because of the change in the hormones. Yes. But all, like I said, the first slide when you saw the picture of the breast,
Mm-hmm.
it's the hormones that plays a role on both the fat and the tissues.
Mm.
Yeah, what differentiates and makes. And the immune system of how healthy we are during the times when we have had infections.
Mm.
And hormones change, mainly the hormone changes stress and anxiety in the life. And the other time is when someone going through menstruation, menopause. That's the time when maximum those hormones change.
Mm-hmm.
Or if someone has been injected with hormones for some treatment,
Mm-hmm.
those times. And the immune system, when we have had infections, for different infections in our body, that's the time it can affect your breast. Yes. And the detoxification pathway. If your detoxification, your liver is good, your pancreas is good, kidney is good, they have been detoxifying the waste products that built up, and there's no build up of the waste products. So those all try to help and support and keep your breast in a safer region. And the next one is about exercise and nutrition. These all are very important for the breast tissues to be developing in a healthy manner, or promoting the breast health. You can say only promoting. We are really not sure that how much it can reduce. It can reduce the risk factor compared to somebody that's not maybe in the law of nature of following some of these factors. So what's normal for us? So is very different. So how our breasts look and how our breasts feel is very different all the time. Especially before menstruation, after menstruation, they're very different. So it's important to understand that. It's just to be aware of ourselves. And that's what the doctor does too. When you go to a doctor once you did your mammogram, they call it the clinical examination. So they do this clinical examination, which we can do for ourselves. After menstruation, 1 week after menstruation, we do it for ourselves. So I have some simulators here, breath health simulators. You can we can do it at the end of it. It's very important to know how they look, how they feel, and to report those changes to the doctor. I always felt like when we are doing the breast examination for ourselves, we always have a mirror in front of us, and then as much as we can, we raise our hands. Some of us don't raise the hands too much, because you saw the picture of the breast. Everything is on the picture of that breast, what we saw, the anatomy and physiology. The breast cancer can go up to the pectoral muscles, or up to our neck here, the lymph glands, and up to our axillaries goes up. So you need to get all that space above. So you need to examine into all that spaces and into your breast, both the breasts. So it's important to understand that. So it's very important to raise our hands very high. And it's important to keep those pectoral muscles, the chest muscles tight, because you really want to get that fine changes. So I have 4 or 5 simulators here, and if you're interested, you can look at it and feel for it. And there are changes in that. You can take a moment just to feel how breasts feel when you're at home, you can do it for yourself. It's a little bit oily because it's a simulator, so I would suggest using gloves. I would suggest, because it's been kept in place, because the tissue needs to be a little bit soft. If you have smaller hands, it's not going to break, so you can just feel for it. And there are three main techniques that we use in the breast when we are examining the breast. So a person, like I said, you raise your hands up all the way, you put your hands on your chest, and you can bend all the way, and then you need to get all that into space from your axillary. You always start at the axillary. So you can either use one technique where you can start from one end, and you can use in a circle. And when you do, you look, and then you feel and see how it is. And then you see any change, lump, hardiness. Okay? Yeah, you can feel how big the lump is, small or big. Yeah. You can look at the color and see the changes in the color, if anything that is there when you look at the breast. Any swelling, if it's warm, if there's any redness, you can observe all that. Okay? So you can keep doing that, and you can come up to the nipple area. It's very important to look at the nipple and then press on the nipple to see if there's any discharge. If any colors of discharge, blood or anything discharges there, it's inverted, it's gone. If someone had a flat or inverted from small, that's different. We are looking for a change. We are looking change from the normal. Yeah? So look for that. Yeah. So it's very important to look if there's any dumpling, anything that goes in. And that's why keeping the hand up is very helpful. It helps to see whether there's a dumpling or a puckering or anything that goes into the tissues, anything that dimples into the tissue. Any other scaly, rashes, anything that you see changes which is abnormal. Not the deodorants and sprays that make our color change in the breast, not that. It's just something which has happened with some changes under the cells, it reflects on the tissue. That's when we need to go and examine ourselves with the doctor and look at the nipples and see how it is, any discharge, any pain that you felt in this, which is different from mastitis or inflammatory breast. A pain
Isn't
that
that what they
doesn't stop.
say too with breast cancer, there's not really pain? That's why
Yes,
people don't find it.
Yes. yes, because remember those two things I said, it can be contained in a cell, so it will behave itself, so it's not going to cause you any problem till it grows big. Yeah, some may live with it and some may have it excised or removed, or then it starts growing into cells. If it's much deeper into the ducts, it's not able to be examined, so it's hard for a person. So you can only know certain changes, and that's why the screening procedures have started after 30, 40 for one to examine.
I see so many women doing this that it makes me just crazy. I have friends that like put their phones in their like bras.
Oh yeah.
I'm like, oh, what are you doing?
So you can use that round technique, or you can use a wedge technique where you can go up to the nipple here and come back, and then again go up and then come back. So you're not missing any spot. So you're just going the same way like I said, but you use a wedge technique. Any one technique should be followed, or you can use one which goes up and down like this. Like horizontal vertical pattern, you go up and then you go down. Yeah?
I know my doctor too, and this is, but told me to also make sure to pay attention to my partner, that, you know, during sexual play or whatever, if he noticed anything, just say something right away. Because she said a lot of times partners won't think to say if they don't notice or feel anything different. But it was very important to include him in that process.
Yes, you're very right. So it's the look and the feel.
Yeah.
So not to be scared, because we're always scared that we may find something, so we tend to avoid it.
Yeah.
But it's good to know sometimes whatever you feel, it may be just be normal for you, rather than for another person. It's important to know whether it's growing, whether there's a change in that, and then we inform your GP. And can always inform if you still don't think that I don't know what it is, maybe it's normal for me, I want to get it checked out. There's no harm, you can get it checked out. Okay? So knowing what is normal for you, and then getting to the doctor where they do the clinical examination. So you doing yourself and the doctor does it. So it's a kind of a, in statistics or in terms of preventing breast cancer, we don't say that they help to prevent, but help you to recognize at least. There's not strong evidence they may help you to prevent the cancer, but recognizing them in the early stages. And sometimes it doesn't, and you just get it recognized in a screening. So that's why screening is very important for all women all over the world. Yeah. Any populations, any socio-cultural populations, usually anything, it's very important to have the breast scans. It's called a screen mammography. They have digital mammography and they have the 3D mammography. There are 3 things. So what we usually do here by the DC Cancer Clinic is the screen mammography. They have at the Royal Millet Hospital, just opposite. You can walk in, you can call in and take an appointment, or you can go through your GP. It doesn't matter how you do it, as long as you can do it. Yeah. And they'll just screen you out. And then if they find a doubt, then you'll be followed up from the RH. They'll get a call from the Raw Fawcett Breast Health Clinic, and they'll call you and take you for a triple test. They'll do 3 tests on you to see that is there a change really, to examine that. So mammography does help to pick up. Mammography even today is a gold standard in science as well as in medicine. It helps to pick up changes in the breast. But it's not so fine like a magnetic resonance imaging or very, very fine like a biopsy or like a fine needle aspiration, but it does pick up changes. And it's helpful to know if it's always important to have your baseline first. So if you took that first baseline, you'll always see the change across. So if you did not take and you took it at the age of 50 or 60, you don't know whether it was there before or it has happened that time. So it's very important. And so when you go to the doctor, this is what they're going to tell you. Oh, your whether it's A or your B or your C or D. So it's just staging for them. For them, they call it clinical staging. And they just stage it according to what cancer they see, and they want to relate to you, and they'll explain more to you. For us, what it means is, okay, there is a chance, they'll tell you with A, that maybe in the long term, 10% a chance of getting a breast cancer. Okay, if you have the BIRADS A, and you can see here's the cancer. Here, this is like a calcification, you can see this, and you can see the cell, how it is like very lightly shaded, very light whites are there, and you can see it very clearly here. So the radiography will mark it here, so then next time you come, they'll observe it and they'll see. So someone who says, okay, you're B, the doctor says you're BIRAD B, they'll say BIRAD B because they go by all these terms, because they have staging for them. Then they see, okay, 40% chance that you may develop, so we need to have you screen much frequently. They have, yeah. And then there's BIRAD C, where there's again 40% chance in BIRAD D. So when you look at this, if you see that it's all fully white, it's called a dense breast. So people from different origins, especially Southeast Asians, different races, African, in East India, all these women, they tend to have a dense breast compared to the other ones who have a lighter breast. What it means, the fatty tissues are so heavy, it looks almost white inside. So if there was a cancer or something, a tiny growth there, we cannot see it. So they need to go often for screening to just rule out, is that cancer, is it a lymph node, is it a lymph gland, what is that which is growing there, like a small calcification. That's what they do, okay? So you did your own physical examination, doctor did the clinical examination, and then you can get a screening test, and in the screening test, if you pass, you get pass at that time, and you don't have to do anything else. You just have to go your usual screening after another next 2 years. But if there was something, or they want to rule out, or they want to check more on that, then they'll tell, okay, come in for an ultrasound. So you can go for a breast ultrasound. They'll do sound waves are done on the breast, and they try to pick up if there was changes in the tissue. So that was screening mammography, which does only screening. Then you have the mammography 3D. So if they have a doubt and something on that, then you'll go in for a 3D mammography. It's like slices, like your cabbage slices. So every slice, every tissue of the breast is going through the mammography like a 3D. So it takes a 3D image of every cell, every tiny cell from all 3 directions. So they will see, is there really a growth? Is there a change? Is there a lump? Is there a cancer? Is something growing there? They will look at it, they will mark it, and they will see and observe the changes on that. And then you have the magnetic resonance, which uses magnet waves to be able to understand the cell changes and differentiation in the cells. Okay? So they may grade the tissue, they call it grading the tissue, whether it's differentiated, well differentiated or not, and that's how they explain to you at the end, okay, the tissue looks like this in the breast. Develop a 10% chance, or maybe we need to do this intervention, and this is important for them. Now clinically this become important for doctor to explain to the patient, like, what is the option for you to do a treatment? So if you did the surgery, or if you did surgery with the radiation, or with the chemotherapy, or you did the hormone, how much chance will you reduce your breast cancer for the second time, or prevent the recurrence, or prolong your longevity of your good life?
So are all 3 of those screening options, are they something available in Kamloops, per se? Or
Yes, in the Royal Millet Hospital. They do it on the same day. They have, it's called a triple assessment.
Oh, okay.
Like
So-
my friend's mom went to the
Yes.
mammography clinic. Not even half an hour later, when she was driving into her driveway, they had called her and asked her to please make her, like she will have to go this afternoon or something. Like it was all within a very quick, yeah.
Yes.
She was like that same day, she had to go for more testing over at the, yeah, it was so fast.
So much better.
Yeah. So not everyone will have the MRI, what I said, but they will have definitely the mammography, ultrasound, and clinical examination, and that's what's covering triple. The MRI would be where they're really certain, yes, this may be a cancer, this is a doubt, this is a dangerous, we have to get it more examined. So you can go for the MRI, or they can do the fine little aspirations, take a biopsy tissue and study more about it. Okay? So you have ultrasounds which can be helpful to detect along the way and see if any changes are there. You have mammography that you have examined. They do 2 types of mammography. They make you stand in different ways, so they're able to see your contralateral side of both right and left breast, and they're able to see the sides of the breast. Yes.
We're going to watch the rest.
Yes.
Thank you.
Thank you, Prakash. So magnetic resonance, this also shows some changes if there are on the cells, and it's used in addition to other tests to understand. So if you think that maybe some of you yourself, we as a person or our family members have not been screened, so why is it we don't screen ourselves? Why we don't screen? Or if you think this is a time now to come into change, what do you think can be changes that can be there? This is about the biopsy. So we went through to say that if there is some changes in the cell and they want to have it staged or want to look at the stages more of the tissue, then they go through staging, and they will stage it as 0, 1, 2, 3, 4, 5. And then if you have grades, then they'll go through the tissues to see what grade the tissue is at. This biopsy and diagnosis makes importance for the patient who has the cancer, because that defines what option she's going to say, what option she's going to understand is better for her healing journey, or curing the cancer, or preventing or recurrence for it. So when you think about staging, I said the 0 can be very small. It's in situ, it's in place. It's very small, it's very negligible. You have higher chances of prognosis, higher chances of preventing the cancer. As you go into 1 and 2, this is the early signs of the breast cancer. There is a cancer, the person does have a cancer. And there is better treatments with them. 1 and 2 have better stages, they're still inside, they are not crossed, they're not metastasized. So there's a tumor, yes, and some of the nodes can be affected, yes, but there's a treatment options. One of the treatment options can help the person. There's a size 2 centimeter or 5 centimeter. When it goes to 3, it becomes a little bit advanced. It metastasizes, it's growing, it's reaching out. The cells are growing into other cells. They're destroying other cells. They're going into the blood. They're forming its nodes into other organs, the liver. So they become advanced. And they go into 4, it's already metastasized. Anywhere in the body, it's gone along, it's metastasized, it's hard for a person. So survival rate will decrease by that, like 20% of its survival. But in 0 and 1, you have almost 100% chance of being cured. So the earlier, what it means to us, meaning is the earlier we find it, they are much better if they are in stage 0 or 1 or 2, and we can get better treatment options. And if we don't get the cancer, then we don't have it. We don't need to go through all these options. So the options available to us in the hospital, or the doctor explains to us these options, like based on our staging. And there's one more, grade, which I didn't talk about. Grade is what they do in clinical wise. Look at the tissues and say how good the tissue is. Good, bad, ugly is a simple word I can use, but they look to see how differentiated, how the tissue is, how it grows, and what it's doing to the neighboring tissues. It looks at all that. So they have 2 ways at looking, and then staging, and then they put these options in front of you. Okay, we can do a partial mastectomy, or we can do a complete mastectomy because all these tissues are involved. We can save the skin of your tissues, so breast skin can be saved. We can do a reconstruction later. So they may tell you that how much of your breast removed, the margin size of it, they will explain to us surgery. If a lobe is removed or how it is removed. Then you need to go in for a chemotherapy based on to reduce that cell to prevent a recurrence. Then you need to do a chemotherapy after this. You have to do alternatively a radiation, so radiation to contain those cells. You can do a radiation along with that. Some of them may have to go on hormonal, because remember the risk factors. We spoke about hormone being one of the main risk factors. So some may have to be put on hormones, tamoxifen, and some, you remember we said about genetics and family. They may not need all these options, but they may need the hormones. So hormone therapy for them. Yeah. And targeted therapy like immunotherapy, and just targeting to those cells. They have certain treatments are available, and the best choice is whatever that person decides with the doctor is helpful to him, or to how he reacts to the treatment or the options. You can take a moment to think about what we said and what is important from this, what did we learn from this point. If you have any questions, you can let me know. So understanding your risk, knowing what's normal for you, get yourself screened, and then what do I do? How do I reduce my risk? I spoke one time before about risk reduction. We have only 4 ways to reduce our risk. The one way is they have the mastectomy, the other way they have what they call is, today is genetic counseling, and the other way is about lifestyle. The other way is only going by the lifestyle choices, which is some amount to reduce our risk for developing breast cancer. Is about our weight, very important about our body mass index. Our height and our weight. We can't do anything about height today, but of course, weight. So getting into exercises. I have some stations they will talk about exercise or preventing cancers. So at least 3 times a week about exercise. And then 2 times a week at least about resistance exercise, so strength and resistance exercise, which have helped to encourage good hormones in the body, help to grow the happy hormones or the happy cells, neurotransmitters, which help to reduce the number of risk for getting the cancers. Limiting alcohol. So someone who doesn't take alcohol is much less a chance to get the breast cancer. Of course, if he has other risk factors which are at low, 0.0. But somebody who takes 1 glass of wine has much less impact than somebody who takes a 3 or 4. And at this point, it also depends because somebody is having secondary diseases, someone's having a cardiovascular, diabetes, a liver problem and all, and that is also causing something different. Or it depends on your doctor's conversation. The doctor would have told maybe wine may be helpful to somebody for some reason. Maybe he's taking a certain wine which is helping to protect his heart, the red wine or something. So that conversation has to be had at your doctor's level of looking at kind of alcohols that you take and looking at which one of them are good and how much quantity, limiting it. Okay? Limiting use of hormones, especially after postman in the menopausal period. We like to take some hormones because it helps in our calcium, in vitamin D synthesis, and it helps us to keep us in shape, in rigor, in health. So looking at estrogen or have a conversation with your doctor. Is this good? Don't just take off the counter certain kinds of natural supplements, they say certain kind of things which you're not sure what does it contain. So try to look. Multivitamins are good, yes. Multiminerals are good. They are healthy for the body. But other than that, if you see something off the counter which says it's good, always try to look what is it saying, what does it have. And get into those ingredients or nutrients, what does it say that these have. Because if they have hormones, they're not going to help you. Okay? Breastfeeding, like I said, that can only happen at the time when you're having a baby, but not otherwise. So it can be helped. These lifestyle choices can help us along the way if we have used them to reduce the risk factors in this. So important in breast health is looking at your tissues, which you cannot change. The tissues remain, but they need to be healthy. So looking at balancing the hormones that we have, looking at our immune system to keep ourselves healthy, even in the time when we are having illness. Looking at our detoxification pathways of how our waste products are eliminated from the body. At how our nutrition is, like how healthy are we eating. Not only that, how healthy are we digesting it? That's very important. The elimination of it is also very important. So is our digestive tract good? Is our elimination system good? Or are we absorbing all these toxins that we do in the body? And stress plays a role. Stress and anxiety do help to change the amount of hormones or neurotransmitters in the body. So keeping all this to a certain extent will help to improve our lifestyle and improve our choices and help us to reduce the risk factor of developing cancer. So this is a study which shows American Sports Association. They give a lot every year they publish a lot about exercise. And they say that exercise does help for all kinds of cancer. And for breast cancer also, it's very important to be doing exercise to reduce our risk for developing breast cancer along the way. And especially once a woman with a breast cancer, a man with a breast cancer has gone through treatment, exercise is very important and beneficial for them to prevent the recurrence of it. And there's another study which talks about the exercise of how it helps to prevent or reduce our risk for cancer. It does help for all other disease and that's why it's part of our life. But for cancer related, even during the treatment, when somebody is saying I'm having fatigue, I'm having side effects from chemo or radiation or immuno or hormone therapy or targeted therapy, it's very important for them to get in the system. They don't have to do it rigorously, but they need to start something at some point to come into change. Yeah? So how do we plan to come into our change? We can think about what is our commitment to changing. There are many things that can happen in our life, many barriers, many things that prevent us from doing certain things which we think we can do. So what do you think can be barriers or what can be something which will avoid us to come into change? Why do you think that something from all this that we learned, what prevents me not to do them or to do them to a smaller extent?
People are scared of getting detected for breast cancer.
Yes.
Yeah, I know I have a few friends that like in their early age they started getting lymph nodes and I asked them to go to the doctor. They were just scared, they don't want to go. They are aware like this can grow into a cancer, but just now they don't want to. Yeah.
Yes. So it's a socio-cultural thing that person will have, like sometimes with them, or the education. Sometimes somebody cannot go because of access in some populations, the treatment where it is available. If they're in the interior, rural, remote, it makes a difference to them. If they belong to certain populations where their access to treatment too is very different. In Canada, the way the people get the treatments are so very different, but they really do have a good system here in Kamloops and in BC and Canada compared to USA and some other places where that health disparity does matter for them. The racial access and the diversity, inclusiveness does matter to them. So there are some things that can help, that can prevent a person not to be able to commit to change, like exercise or diet or prevention or reducing stress or anxiety. And there's a lot available in our community too. They have a lot of clubs on Tai Chi, yoga, dragon boating, everything in exercise related, physiotherapy, and it costs too. Yes, cost is a matter for them, pilates and all this. So once we are aware that, okay, this is what it is, this prevents me, I'm aware that I have to reduce my risk and I'm aware of this. How many of us like to do then exercise today that we are aware? How many of us feel like, okay, I'm aware of it today? Are you aware like today that it's important about, just let's go with exercise, taking an example. Yeah, so then maybe you'll be standing in this column here which says commitment to awareness. I'm aware. So I'm aware for today that, okay, I need to do exercise. So I'm aware I need to be healthy. Some of us understand. Do we understand really how these risk factors make a change to us to develop a breast cancer or not to develop? Do we really got that understanding of how these, yeah. So then you can just raise your hands or stand in that column where you say commitment to understanding. I do understand that these are risk factors. This is what's normal for me if I get screening. So I understand this may help me. And I'm how many of us are ready to take the action? Like I'm going to do every day 30 minutes of exercise today. Whichever exercise system or fitness or physical activity you like, you can stand in that last column. I'm ready to do the 30 minutes exercise today. So that is the commitment to change or intention to review our goals every day or an intention to make my personal plan or choices how I'm going to be doing. So just to wrap up the session, we have done a few things about some action items that we can do for ourselves or encourage maybe the people that we love to how important certain things are in life and why it makes, why that awareness. People say sometimes, I don't know what is awareness. What do you mean by just awareness? Awareness is what? I don't know. What do we say by awareness? What do you mean by that? So awareness is just I'm aware, like you said, I'm aware. But is that really translating into our understanding and into our practice? If we are practicing that, that awareness has a meaning for them. And that's why it doesn't make meaning for many people because the awareness is not really the awareness. It's just like for them, it's out there. The information is out there, but that doesn't make sense to anyone they have. So if you are aware today, this is in your brochure, you have a post-test there. You can turn the page and you can look at it. There is a post-test for you to see. You can look at the post-test on page number 6. It tells you certain questions and you can read how it is for you. And you can answer them to see what is it that you know now today that can be helpful. And what is it that you're going to, where you need more information session. And what is it that you need more awareness. So that's where you need to go out and seek information. I need more awareness on this section. Maybe I need more help on this, and this is where I need to take that information. So at page 12, you have certain resources in Canada, very good resources on cancer, preventing cancer, promoting cancer, and given that if you have any loved ones who are going through cancer, there's a survivorship program in Kamloops, and they do a very good job of helping them to survive. Like I said, it's very hard to use the word surviving because every cancer person is different. So it's not actually it's beyond their control. It's not actually surviving, it's actually thriving in that environment, controlling and managing their illness with family members or with the person they love and helping them to grow through that, making them strong, positive and confident is what I look. It's not like a battle or a journey like in military terms, but it's actually them in that situation, how they are being able to cope and at least manage that situation is what I do. And knowing your commitment to change. At the end of it, page 15, there is a page for feedback. You can leave your feedback. You can take it out from this paper You can pull out the paper and you can write your feedback that can help me to understand how the session was, how the modules were helpful to you, and you can leave the feedback behind. And if you have any questions, I'll be around here to help you to answer them. Thank you very much for joining me today. Thank you. Do you have any questions?
No, I was a survivor. I was trying